Welcome to the deep dive.
Great to be here.
So today we're tackling a topic that can be quite concerning for pet owners.
Hemangiosarcoma of the skin.
Right, in dogs and cats. We've got a stack of medical info here, and, well, our goal is really to understand this condition.
Exactly, to sort of pull out the key bits from these medical sources.
Yeah, figure out what it is, how it shows up, and, what's important according to the material we have.
We'll break down what it is, how you might see it, and what these sources really highlight.
Okay, let's dive in then. So hemangiosarcoma, basically, it's a pretty aggressive cancer, isn't it?
It is highly metastatic. It starts in the cells lining blood vessels, the vascular endothelium.
And when we're talking about the skin form, that means it starts right there, in the skin or just underneath.
Correct. It's considered a primary tumor in that location.
Now, how common is this skin form compared to other hemangiosarcomas?
Well, according to our sources, it accounts for about 14% of all hemangiosarcomas in dogs.
Okay, so it's a specific slice of a larger problem.
Precisely.
And we know listeners might be here because, well, maybe their pet has this, or maybe they're just really interested in vet med.
Right.
So we're planning to cover who gets it, the signalment,
Signalment, yeah, like
Yeah.
the typical patient profile.
what signs to look for, maybe why it happens, how vets diagnose it, and, of course, treatment options.
Sounds good. Let's start with that signalment then. Who's most likely?
Well, the sources say both dogs and cats can get it.
And for hemangiosarcoma, generally, they mention breeds like pit bulls, boxers, German shepherds.
Right, but for the skin form specifically, the dermal type, it's a bit different.
It seems so. The excerpts really point to whippets, greyhounds, and similar breeds for that dermal presentation.
Interesting. Makes you wonder if there's a different trigger or something.
It does suggest that, yeah. And age-wise.
The median age is around 9 years old.
But there's a range, right?
Yeah, quite a wide one. Something like 4.5 years up to over 15.
Okay. So moving on to signs. What would you actually see on your pet?
What are the clues?
For the dermal type, the one right on the skin, look for firm, raised nodules, often dark.
Whereabouts?
Could be lots of places. Limbs, head, face, ears. Even the prepuce, nasal planum, the nose leather, or the belly.
And you mentioned a specific look linked to sun exposure.
Yes, that's really key. If it's on the ventral abdomen, the belly, or groin area, and it's linked to UV light.
Like from the sun.
Exactly. It often appears as multiple small, kind of blood blister-like nodules.
Okay, that specific pattern sounds like a definite red flag.
It really should prompt a vet visit, yes.
What about the deeper ones? Subcutaneous or intramuscular?
Those are usually just one lump, though you can get multiples. They tend to be larger than the dermal ones.
And how do they feel?
Could be firm, could be soft. Sometimes there's bruising around them. And importantly, bleeding within the tumor is common.
Ooh, okay. Any typical locations for those deeper ones?
The back legs, the pelvic limbs are mentioned frequently, but honestly, they can pop up anywhere.
And for cats, is it similar?
The locations mentioned most often in cats are the flank, that side area, the belly, the groin, and the neck region.
Got it. So we know who gets it, what it looks like. Let's dig into the why.
Yeah.
Causes, risk factors.
Well, for dermal hemangiosarcoma, that link to UV radiation is strong.
Especially where the fur is thin or the skin is light-colored.
Exactly. The source even mentions actinic keratosis sun damage, basically as related. It fits with that blood blister look on the belly we talked about.
It really does paint a picture. What about the deeper subcutaneous ones? Any similar environmental link?
The main thing mentioned there is sometimes developing after previous ionizing radiation therapy.
Oh, for treating something else.
Yeah, for a different condition entirely. That's an interesting potential link.
It is. Okay, so let's say a vet suspects this. How do they nail down the diagnosis? What else could it be?
Well, there are differential diagnoses, things that look similar, like just a bad bruise from getting hit, a hematoma,
Yeah.
or other types of soft tissue cancers, sarcomas. Even mast cell tumors can sometimes look like it.
Right. Does standard blood work usually help? CBCs, chemistries, urine tests?
Often those are actually normal, according to the source.
Really?
Yeah, unless there's significant bleeding from the tumor. Then you might see some mild anemia, the body trying to make more red cells, or maybe a low platelet count.
So basic tests might not show much. Are there more specific blood tests?
There are a coagulation panel looking at clotting factors like PT, PTT, D-dimers.
Mm-hmm.
That might show changes suggesting something called DIC, disseminated intravascular coagulation. But that's more likely with the big bleeding subcutaneous or intramuscular ones.
I see. What about imaging? X-rays, ultrasound, how important are they?
Oh, very important,
Hmm.
especially for staging, seeing if it's spread.
Like checking the lungs.
Exactly. Chest X-rays or thoracic radiographs look for metastasis there. The source describes what those might look like on the X-ray.
And looking elsewhere in the body.
Abdominal ultrasound is key. Checking the spleen, the liver for spread, or even for a primary tumor there. Also looking for weird nodules floating around or fluid, which could mean bleeding.
Any other imaging? Heart.
Echocardiography and
Yeah.
ultrasound of the heart can sometimes spot masses in the right atrium. It's apparently easier to see if there's a bit of fluid around the heart.
And more advanced stuff like MRI or CT.
Yeah, those give really detailed views for figuring out the tumor's exact extent and planning surgery.
But there was a crucial point about the purely dermal type, wasn't there?
Yes, very important. True dermal hemangiosarcoma often behaves much less aggressively, so it might not need all that extensive staging.
That's good to know. So imaging tells part of the story. What about actually looking at the cells? Cytology.
Cytology, using a needle to get cells, is often, well, not that helpful for hemangiosarcoma.
Why not?
You often don't get many tumor cells, and the sample gets heavily contaminated with blood. Makes sense given it's a blood vessel tumor. If you do find cancer cells, they have certain features, shapes, the source describes them, but it's not the most reliable method.
So what is the reliable method, the gold standard?
That would be histopathology. Taking a tissue sample, a biopsy, or the whole mass after surgery and looking at it under the microscope.
And that gives the definitive answer.
Yes. The pathologist looks for specific patterns. Cancerous cells trying to form abnormal blood vessel channels.
Ah, okay.
They might see solid areas of abnormal cells too. This microscopic exam is how they tell it apart from a benign hemangioma and figure out if it started in the dermis or deeper down.
But it sounds like sometimes it might not look obviously like blood vessels under the microscope.
That can happen. In those cases, they use special stains, immunohistochemistry.
Stains.
Yeah, stains that stick to proteins specific to blood vessel lining cells, like von Willebrand factor or CD31. That helps confirm the origin.
Clever. And once it's confirmed, is there a staging system based on that tissue sample?
Yes, a histologic staging system just for the skin form. Stage I is confined to the dermis.
Just the top layers.
Right, stage 2 means it's gone into the subcutaneous tissue underneath.
Okay.
And stage 3 means it's invaded the muscle.
Got it. Stages 1, 2, and then 3. So now we know how it's diagnosed and staged. What about treatment? What are the options?
The main treatment, according to our source, is surgery. Aggressive surgery.
To get it all out.
Exactly. Aiming for clean margins, no cancer cells left at the edges.
What if you can't get it all, or what about after surgery? Anything else?
Yep. Radiation therapy can be used afterwards. Definitive radiation to zap any microscopic bits left behind.
Okay.
Or, if surgery isn't possible, palliative radiation might be used. Less intense, more for comfort. The source mentions maybe a 60% response rate, but survival times are shorter, less than 100 days usually.
And chemotherapy, does that play a role?
It can.
Mm-hmm.
Doxorubicin chemo showed some success for tumors you can't remove, the subcutaneous or intramuscular ones.
Mm-hmm.
Survival around 130 days in that scenario, based on this info.
Mm-hmm.
There's also metronomic chemotherapy.
Metronome.
Yeah, low doses given regularly, long-term,
Mhm.
often used after surgery.
What's the idea behind that?
It's thought to inhibit angiogenesis, the growth of new blood vessels the tumor needs, so it might help stop it coming back.
Are specific drugs mentioned? Dosages.
Yes, the source gives details for doxorubicin, based on dog size. It's given IV every few weeks usually,
Okay.
and it mentions metronomic cyclophosphamide. That's a pill given daily, often with an NSAID like piroxicam. Dosages are in the source too.
And that can be used with doxorubicin, or instead of it.
Seems like either alongside it or as an alternative, yeah.
Now, these are strong drugs. We need to talk about side effects. Doxorubicin.
Absolutely. Potential issues include GI upset, bone marrow suppression.
Low blood counts.
Right. Heart problems, kidney issues, allergic reactions, even tissue damage if it leaks out of the vein.
The heart issue sounds serious.
It is. There's a risk of cumulative heart damage, so monitoring heart function is important, especially for some breeds or dogs with existing heart conditions.
What about the cyclophosphamide used metronomically? And the NSAIDs?
Cyclophosphamide can cause sterile hemorrhagic cystitis bladder inflammation with bleeding. The risk is generally lower with metronomic dosing than traditional chemo, but it's still a possibility.
Okay.
And NSAIDs, well, common side effects can be GI upset, and potentially liver or kidney issues with long-term use.
Anything about alternative treatments in the source?
Just a brief mention, actually. Immunotherapy using a medicinal mushroom extract,
Oh, which one?
Coriolis versicolor, contains something called polysaccharide peptide. The source suggests it may have some effectiveness.
Interesting, very interesting. Okay, so after treatment, what's the follow-up like?
Regular checkups are crucial. Physical exams, blood work, chest x-rays, abdominal ultrasounds.
How often?
Every 2 to 3 months after treatment ends, typically, to watch for recurrence or spread.
And for those on metronomic chemo?
Monthly urine tests are recommended to check for that bladder inflammation, the cystitis.
Makes sense. Now, the source didn't really list specific prevention tips, which isn't surprising for cancer.
No, not really.
But are there complications from the disease itself to worry about?
Tumor bleeding is the big one highlighted. Given
Really?
where it starts, that's a major risk. It can be serious.
Okay. And finally, the big question, prognosis. What can people expect?
It really depends on the type. Dermal versus deeper.
Let's start with dermal, the skin surface one.
For dermal HSA, the prognosis with surgery is generally very good. The source gives an average survival time for dogs with just surgery as around 987 days.
Wow, that's pretty long, over 2.5 years. And cats?
For cats with dermal HSA and surgery, the disease-free interval mentioned is over 450 days. Also quite good.
That's definitely encouraging for that form. What about the deeper ones, subcutaneous?
Subcutaneous has a higher risk of spread, but aggressive treatment can make a big difference. Surgery alone, the average survival is maybe 172 days.
Oof, much shorter.
But add doxorubicin chemo after surgery, and that average jumps way up over 1,100 days, according to this source.
That's a huge difference. What about intramuscular, the deepest one?
For intramuscular, with surgery and doxorubicin, the average survival time mentioned is around 272 days.
So still challenging, but better than surgery alone for subcutaneous. It really shows how location matters.
Absolutely. And the stage. The source emphasizes that stage 2, subcutaneous, and stage 3, intramuscular, have a much higher risk of coming back locally or spreading elsewhere.
Okay. So, wrapping this up, the big takeaway from our deep dive seems to be this major split, doesn't it?
Definitely. Between the superficial dermal form, often less aggressive, better prognosis.
Right. And the deeper subcutaneous and intramuscular forms, which are much more worrying in terms of spread.
That's the critical distinction. And it highlights why finding these things early, especially any weird skin lumps, is so important.
And why aggressive treatment, particularly for those deeper ones, seems key to improving the outcome.
Precisely.
And it was interesting, too, seeing that mention of research into things like immunotherapy, maybe new options down the line.
Always hopeful for new developments. Yeah.
So maybe a final thought for our listeners to chew on.
Okay.
Given that really strong link we discussed between UV light and the dermal form in pets, what parallels could we draw, maybe, to skin cancer in other species, even us?
That's a great question. And what further research could really explore those connections, across different types of animals and maybe even understand the mechanisms better?
Something to think about.